When someone can't get into a rheumatologist for at least a year to be seen, there's a significant window of opportunity that's missed in treating that patient. They may actually experience damage to their joints that is unnecessary if they were able to get in to see a rheumatologist faster. They will be not as productive as work, likely take many sick days, and this significantly impacts their family life and their life with their friends as well.
My husband is one of over 74,000 needing surgery in our province. He isn't special, but he is to me. It has been 56 weeks since my husband's brain tumor was diagnosed and surgery determined. Can you imagine having headache pain all the time, waking up in the middle of the night, day after day? No one cares that we are impacted by this weight. And believe me, I've tried to get someone to care. No one cares that you are fast approaching the time when your bills can't be paid. You have no food on the table, no retirement funds available, nor a roof over your head. A surgical wait list affects more than just that individual.
I think from the patient perspective, the most challenging thing I see is that the patients are in limbo when they don't have a designated time period over which things are going to occur. Wait times have to be patient-centered. They have to be based around the fact that these patients are undergoing extreme amounts of stress when they're waiting to get into the system to get their necessary care.
After more than 2 years of waiting, I now finally have received a date for surgery. There were times this winter when I wondered if I'd last until I heard something. It seems like most officials have no idea whatsoever of what it's like to face an indefinite wait. Do you know how insulting, patronizing, and infuriating it is to constantly be told to do this, that, and the other, which I'd already tried or had proven impractical? I am most grateful that I now have a date for surgery, but I am very conscious of far too many who are still waiting without one.
I think the biggest impact for my patients is not knowing what the wait is going to be. For them, the wait begins when they first have a problem and they decide that they're going to see me or one of my colleagues in my office. They want to know that their problems are going to be prioritized based on their urgency and that they're going to have information about when they will receive care.
My husband waited 1 year to see a surgeon and 2 years for the hip replacement. The pain he went through while waiting for surgery was unbelievable. While we waited for surgery, we spent all of our RRSP money to get by month by month.
The wait times in geriatric medicine are most important at the outpatient level. So in the community, people waiting to be seen who are living at home, taking the wrong medications, falling, becoming delirious. The impact of wait times would really be patients who could have avoided hospital ending up in the emergency department, ending up in hospital, ending up alternate level of care, and ending up in long-term care because we didn't get to them fast enough.
Kids are waiting too. Kids with congenital anomalies, kids that are disabled by diseases like cerebral palsy and their hip is out of joint and they're in pain, they're in a wheelchair, their spine is curved, or they have some unknown lump. You can only imagine what a parent goes through waiting for their child to have surgery. It's a sad statement that up to one third of children in Canada are waiting for surgery beyond our known benchmarks for waiting. That is waiting too long.
J'ai vu qu'il y a environ 10 ans, on a focusé beaucoup sur les temps d'attente. Il y a eu des sommes considérables qui ont été investies par le gouvernement fédéral en collaboration avec les provinces pour diminuer les temps d'attente. Ça a eu un certain effet, mais on a vu aussi dans les 2-3 dernières années un rebound, une augmentation, une réaugmentation de ces temps d'attente-là. Le message que j'ai à donner au gouvernement fédéral, c'est que il faut vraiment qu'il se réintroduise et se réinsère pour être le leader dans les innovations technologiques.
The number one message is seniors' care is going to overwhelm the healthcare system. Seniors already consume 45% of resources, and that's going to skyrocket to the lion's share of resources. What we need right now is a seniors' care strategy, a national strategy that's consistent across all the provinces. And if we don't have that, then it's going to place the healthcare system at jeopardy, and two-tiered healthcare may be around the corner.
If I were to ask the federal government to do one thing to help solve this problem, is get interested in it. Let's study it across Canada together.
Even though the healthcare system is provincial, I think patients are looking as well to the federal government for some kind of leadership here, to make sure that our healthcare system isn't so disparate, depending on where in the country you live, whether it's a rural or an urban center or what province you live in. And I think we're looking to the federal government to step up and advocate for all citizens of Canada.